What's going on, y'all? I forgot to put that. Where's my And you know what? When I put that thing on, it does make me a little bit clearer. Um, the mic I had on the other day. It does make me a little bit clearer. I don't know why this is not on right here, but you guys, it should be coming on in a few minutes. Because I got you guys already on live. So if you guys got your books, go ahead and pull them out, and you should be ready to go. So you guys know that I did put something out there. I put a couple of things out there. So, watch the post that I'll be posting out there because the chats are going to go private. The billing and the terminology chats are going to go private. So after these coding chats are done, the coding chats will go private, and then it'll be repetitious. I'll have the live classes again. So for you to archive, you have to go through. I know. I was just saying that. For you to archive, you have to be in the Sapphire Academy. Okay, so these links will be in the Sapphire Academy. All you need to do is click. Need a light? I know, because it gives me a better light. That's why I just leaves it on. And you still can archive whenever you want to. Um, we left off. We're going to probably finish evaluation and management today. So again, we have had several chats in the coding, and you guys know the coding. Like I said, the coding class is pretty lengthy, and when I give you guys the homework for it, I'm expecting and hoping you guys should read the information because it's going to give you more insight on the coding. So at this point, you should be able to do the E&M coding. Some of the coding that we already went over, you should be able to get a feel of what coding is, at least by now, what coding is. Because the ICD-10, we kind of went over the diagnosis codes, which we're going to go over again. And each chapter we go over again. But in the CPT, that's something that we learn throughout. That's something that we learn throughout because every chapter in the CPT has guidelines, and you guys must read those. The more we read, the easier it comes. The more we read, the easier it comes. Okay, just remember these chats will be private. Coming the first of the year, we will still be in coding. So coding will not be private until it is finished. Till it is finished. The med term, the med bill, we're done. It's time to close those. They're already uploaded in the Sapphire Academy. You must join the Sapphire Academy to get those. I'm going to put the website here so people can go on there and check it out. Still have that tuition promo going on for y'all. Um, what's the name of that show we did this morning? Whatnot? Okay, so there's another site. It's called Whatnot. I've been going on there. My sister's got me going on there, and I give them the same type of thing. They buy the book, they get program, but you guys have the same type of opportunity. Go ahead and I mean, you guys already have the book anyway. Y'all already in the classroom. Go on the website, and you guys can register for the class there. Because y'all know I'm not gonna micromanage y'all, nothing like that. Just look at the classes, okay? Look at the classes. Type in DB discussion more Miss Lambert. Miss Lambert, I'm lost. That's all you got to say. So just remember, the classes are going to go private once they are done. So the billing and the term, I'm going to private those. All right, this one will not be private. The coding class will not be private until it is finished. It goes into the Sapphire Academy. Okay, it goes into Sapphire Academy. So when the class is over, that's when it is going private. Class is over, it's going private. Okay, so Rennie will be doing that. I don't know. I think she started doing some of them already. I haven't even looked. You guys let me know if you don't see that. You see that stuff in that playlist going private. So she's supposed to be doing it private by now. So I don't know if she started doing it. But that's because, again, you guys have to join the Sapphire Academy, and you still, got those free classes. You still get the free classes because, again, it's going to be repetitious. It's going to come right back down. So if you guys know anybody who want to get in on the class, tell them to make sure they come on and get in. Okay, so we're going to finish evaluation and management today, I do believe. You guys should be kind of used to looking at those CPT codes. Remember the links that I gave you guys. Um, when I close those chats, everything is closed. You can't get in there. So if you are in this classroom and you see me put those free books up there, get them. Get them. Okay. In the Sapphire Academy, the Language of Medicine book is already in there. You don't buy that book. If you plan on joining my Sapphire Academy, don't buy that book. And the Sapphire Academy has the resources in there that you need. Okay. Um, Evaluation and management that we started off with, we're gonna finish that today. I don't think it's that much, but we're gonna go ahead and finish with that today. Again, if you do not have your ICD-10, where is it? We did ICD-10 already. So some of you who are in my classroom that why is it doing that? That are in my classroom that have not went over some of the earlier classes. I'm still going to put the book here. Let's put the book there because you got, I mean, anybody can use it. That's the ICD-10. This is the CPT that I'm putting up here. And this is for you until you buy your book. Okay, until you buy you. I mean, you can buy it from here if you want to. I like the ebooks. Y'all know I like the ebooks. And I have to teach through the ebooks. I have to teach you guys through the ebooks because how would I do? I do see the women, with the books, but I can't. I had a patience to be looking down that notebook and using my finger and trying to show y'all nothing. So I can't do that. I can tell you where it is and you can look at it yourself. Okay, and that's the reason why I try to put the books up here, so you guys can see where you should be at. Okay, where you should be at. Okay, so those are your three books right there. The Higgs Picks. Okay, so let me put that one up there. I did. I put the Higgs Picks up there. Okay, you want the step by step. Okay, wait a minute. Let me go get that one. All right. Okay, so here's the step by step. Keisha wants the step by step. That's the step by step. So you got it? Okay, so hold on a minute. Let me see something. Um, okay, so y'all on Twitch, y'all got it too, all right? So some of y'all on Twitch, some of y'all on YouTube, and then I don't see no messages from y'all in TikTok. But it's up there too, okay? So y'all should be able to get it. TikTok, if y'all don't get it, I'm gonna do a separate. Like I said, y'all know I do a separate thing for TikTok because they don't have the same messages you guys do. I didn't see that in there, so I didn't add the TikTok in there. I just kind of do yours separate. But okay, no, they just can't see what you type in. I can see what you type in. Okay, so evaluation and management, we're going to try to finish evaluation and management today. So any of these links that y'all are going to need, let me know. And you see how this is right here? I put this whole thing down there, so you guys can use that whole thing. Okay, so it's actually at the bottom. Okay, it's a subject at the bottom. So let's move on. Y'all got any questions before we move on? Let me pop y'all up again. Y'all got any questions before we move on? Now don't fret to ask any questions. Again, y'all can do discussion board, or y'all can go ahead and DM me, or y'all can go ahead and ask me a question here. This is your coding class. This class is for beginners. People who have not coded before, or people who are trying to brush up, or people who want to learn a new skill. Okay, and it's going to take time. It's going to take time and practice for you to learn the coding and to be comfortable with the coding. So that's why in this book, there are a lot of exercises in here for you to do. And you see, it's self-explanatory. These are your types of services. These are your key factors that you're going to be using. Your place of service, your type of service. The step-by-step book tells you what is type of service, what is patient status, what is a consultation. And some of this they're going to ask you on your certification. Um, uh, Admission is attention to an acute illness or injury that results in admission to a hospital. I know y'all gonna say, Miss Lamb, we're gonna do the whole thing all over again. I'm not gonna do it all over again. Okay, I'm just scrolling too. Okay, there's some that may not, do this part. Okay, medical records. Y'all want to know what the medical records is about? Y'all know to go through that. Okay, again, we did do all this. I'm just kind of scrolling down to where we should be. Okay. So you guys also were supposed to do this. Okay, so make sure that you do your exercises in this book. Because again, you guys do not have the same exercises in the Sapphire Academy, but these are in your book. Okay, these are in your book. Okay, direct face to face we did already. So again, the stuff that we already did. Just make sure that you take heed to taking your notes. Let me fix this. It's driving me nuts. Just taking notes and, just kind of reminding yourself to do your study. Because during the Christmas time, you guys know I always have those promos and things going on, and I'm mostly available. I'm mostly working at home during Christmas time anyway. So that's why you guys see me kind of fluctuating with the YouTube. I kind of hit the whatnot whenever I can hit the whatnot, but the YouTube has to be done because the courses have to be finished. And again, you guys still get access to the syllabus. If you guys go through those chats, I have one in there for the YouTube. It's the same one that I use for my students on Sapphire Academy. So like I said, I think I did a chat. If you look at all 70 of those chats, you look at them in order, you would teach yourself how to do what you need to do. There's no reason for a student loan to go to school for medical billing and clothing. Even if you have used the resources that I have, join the Sapphire Academy and we still will do one-on-ones, okay? You get an email to enter the academy, okay? So if you have your book, I'm just kind of give you guys some time to bring your book out. Okay. So, when you decide to take a course, you just have to steadfast on it. You just have to give yourself time and make room to do your course. Okay, so let's go to. All right, so we did your categories: category by patient status, code status, place of service, time. How do we code E&M by time? Okay, you guys know what a new patient is, right? That's an officer or the outpatient. It gives you a description, right? So there was also coding in here. Do I have y'all up? Let me put it up for a few minutes. There's also the coding in here. So you remember you guys were supposed to do this coding right here. Okay? If you get stuck on how to do the diagnostic coding, go back to the ICD-10 guidelines. Go back to the ICD-10 guidelines. In the beginning of the book, let me see. I'm about to pull up my ICD-10. Y'all pull yours up. In the beginning of the book, there are guidelines in there, right? And y'all remember what I said about the guidelines. Read. I don't care if you read the guidelines 99,000 times. That's what you're going to have to practice. Okay? So in your ICD-10 coding that you have to do with the chapter that's we're going through, if you forget, yes, go back over and archive your chat for that class. 1. You can also go to the guidelines in your ICD-10 book. If you come across a code and you're not sure if you should use that code for that disease, go back to your ICD-10, look it up, right? Look it up. Whatever the disease is, I don't care if it's cataracts, go ICD-10, go look for cataract. When you get to cataract, it's going to give you 2 or 3 codes. Make sure that you choose the correct one. Okay, like I said, the hardest thing you're going to do in the coding is your tests, not when you're actually coding. When you're actually coding, you're on AI tools. So don't be scared of that. But when you're in this classroom, we don't use AI tools, okay? I want you to make sure that you code, okay? Make sure that you code. Use your step-by-step book and go step by step, because we already did that. But if you have to backtrack, go ahead and backtrack. Okay. So I'm just running down. I know we're in the step-by-step book, but I wanted to make sure that you guys know. Get access that ICD-10 book if you get stuck. Okay, and go to the guidelines, because you've got to do the CPT code, and I want the ICD-10 code. Okay. So established patient we did. The second category of codes in subsection office and or other outpatient. I'm not going to read it. We already did it. You should have your CPT book open right now, because you should be looking at the same thing that we're looking at. Okay. So I'm in a step-by-step book, and you're going to have your step-by-step book open and your CPT book. Okay. And your ICD-10 book. All right. So there's no Hicks fix in here right now. We're just pretty much kind of getting you used to the coding, getting you used to flipping those pages, getting you used to moving your board around. I'm calling it moving your board, however you want to call it when you have an ebook. Okay. So let me show you this case right here. So this case, now let me be reality with you. Why isn't it popping up? Okay, let me see what's my. So this is a good example of what you're going to see on the CPC exam. You look at number 2. I don't know what page I'm on. Hold on. I don't know. Y'all should have your ebook open too. I'm on page 292. I'm on page 292. I'm in the ebook. So that case right there that says a 42-year-old. You see how big that case is? I mean, can you imagine when you're taking your test, how long it's going to take you to finish that case? Exactly. That's why I want you to do the open and close question first. You see them little tiny questions right there? It says a 17-year-old, the one right after. You better be a half a second with that. Because with that case up there with a 42-year-old, you're going to need a minute. You're going to need a minute for that. I can't have you wasting time for that little one when I need you to use some of your time on that larger case. So that's a perfect example of what you're going to see on a CPC. They will have a little tiny case like that you can get through. And then it's going to be 1 or 2 on there that's longer than that. And they do that to make sure, 1, they want to see if you're going to get frustrated with this case. 2, they want to see if you are able to find the ICD-10. 3, they want to see, can you navigate through your CPT book? So that's the reason why I tell you, every now and then you get your CPT book and you just start flipping pages. What I gave you, the book, the CPT book and the ICD-10, those books I gave you, those ebooks, that's temporary for you. You're going to have hard copy books because you cannot take your test with ebooks, even if you take it online. When you get your book, I want you to just go through. Just go. That you'll have to join the Sapphire Academy. In the Academy, we go way more thorough than I have to do with you on YouTube, because I can't do all of that on YouTube. But I'm putting you all in the right place. But listen, I want y'all to join the Sapphire Academy. Go to my website, sapphirephysiciancoding.com. In your CPT book, each page, go through each page. You're going to come across codes that look exactly alike. You're going to highlight one code. If you have 9335 and you have 9334, highlight 9334. Because when you taking your test, you're going to be taking it quick. You know what I'm saying? I don't want you to backtrack and look at all the answers that you put in. I want you to know what you're doing while you're walking in there. So when you get your CPT book, I want you to be able to look at that book and know which one you're going to pick. Okay? So again, you see how big those cases is up there? That's what you're going to need to spend time on. Okay? So I know we ain't half start the class yet. I'm already 22 minutes in. Okay, so we did telemedicine. Okay, we did the telemedicine. All right. We did hospital observation. Okay. And remember, the CPC guide is derived the same way. It's derived the same way. TCU is temporary care unit. Go ahead and put that on the index card. Put that on the index card. Observation is the status used for the classification of a patient who does not have an illness severe enough to meet acute inpatient admission criteria and does not require resources as intensive as an inpatient, but does require hospitalization for stabilization period. Okay? Just a short period of time. They're just in the hallway watching them. Observation care discharge we did. Initial discharge. I know I'm just backtracking. We did that. Now this case right here ain't no joke. You see this case right here? Y'all do this one. Y'all were supposed to do this anyway. So see this case? Like this is bigger than the one that I just showed y'all. Now this is what you're gonna see on the CPC. They want to see, can you decipher this case? So right now in evaluation and management, you should know the steps of coding, evaluation, and management already. This is evaluation and management code. So you know that you're not going to look in the surgery section for an evaluation code. This is the trick to the CPC, y'all. The answer, the question is in the answer. I don't care what tests you take. Okay, if they're giving you an open book, the answer is right there. The answer is right there. You see this case in the evaluation and management section. You know you're not going to go creep into the surgical section and look for what this code is. You're going to stay in that section. You're going to label your book so you know how to get to that section. You know how to get to discharge section. You know how to get to admission section. So, just remember, don't freeze when you see a case this big. Don't freeze when you see a case that big. Because if you do, you're going to make yourself nervous for the whole test. You're going to make yourself nervous. That's why you go through the CPT book thoroughly. So you already know that this is an evaluation and management. Okay, you already know that. Initial hospital, inpatient, or observation care. Okay, initial hospital care. If you get this on a test, go to your section. I don't know what that is ringing. Go to your section, initial hospital care. Okay, go to this section, initial hospital care. Label your book. When you go to my bookstore, you see those little labels that I sell in there. Why I don't have none right here, I have no idea. I have millions of them. They go on the top of your on your book page right here. The top of your book page, so you can flip to initial hospital care and you can go ahead and get your code. And this is why they give you so many exercises in the step-by-step book, which is really good, because the more practice you do, the better you will be at it. The better you will be at it. The better you will be a coder. And when you guys see these codes in here, okay, which code has a time putting 75 minutes, CPT code, 92, that's what I'm doing. Let me see if I can get in there. When you come across these codes, when you're doing your homework, you see 99222, all those codes, look at them. Look them up. Look them up, okay? Look them up, okay? So, all right, so let's continue on evaluation management. I know I'm trying to get down there. I keep stopping on stuff, but y'all know I got to backtrack. Okay, CMS rules. Make sure y'all go on the CMS site and check those out. So you supposed to, I've seen so many large cases in it. You guys supposed to have already done those. Okay, and you can check them yourself. Y'all know the answers is in the back of the book. Emergency department, we did that 99281 to 99288. Remember that? I want y'all to look up those. But we did emergency department the other day. I'm going to read this section right here because I think you might need to know this. This is a new book. So they have made changes to the CPC. So I want you guys to make sure that you know this part. I'm right here on page 306. I'm going to give you this piece right here. Also, ED physicians do not admit patients to a hospital. Remember we read about that, right? Wherever he went to the clinic at, that's the admitting person, okay? If a patient is seen in the ED and has to be admitted to the hospital, the patient's PCP, primary care, or other designated physician will admit the patient. An example of a designated physician would be a hospitalist. A hospitalist is a hospital-based physician. What does that mean? He works at the hospital. He's a hospital-based physician. That's his role. That's where he is. Who only sees patients in the hospital and assumes the responsibility of the primary care physician for hospitalized patients. There is a relatively new approach to hospital coverage, but it is fast gaining popularity. I don't even care about none of this stuff. But hospitalist is a new word that you're going to probably see on the CPC. So I wanted to make sure that you introduce yourself to that. Okay. Emergency department, we did. Okay. 99288, look that up. Okay, you're supposed to have this is like 2 weeks ago we did this, but I'm just kind of backtracking. You're supposed to have looked up these codes. You see how those 99281, 84, 83, 82 fast. You know what I'm saying? When you get a test, right? I'm gonna take that down. When you're taking your test and you see those severity codes, 99212, 99213, based on the severity of the patient, you know which code you're going to pick. I'm gonna put it back up because I don't want to lose you. So you see right here where you guys did your homework, and it's going 99281, 82, 83, 84. On your CPC, if you're using these evaluation and management cases, and they're small, they're called open and closed cases. You already know the key MDM for 99212, 3, 4, and 5. You know 5 is the worst. If they tell you that this patient been seen for 65 minutes, 75 minutes, you know that the patient is going to be severe. The MDM is going to be high. So you know that it's either going to be a 99214 or 99215. So the severity of the patient, depending on the severity of the patient, you're going to know which one you're going to choose. It's going to be quick. Even if you have to go to your book, it's going to be quick. So that's the purpose of you looking at your book and reviewing your codes. Okay? So don't get discouraged when you see that. Okay? So I know y'all went over that before, but I wanted to see. Make sure you do the exercises that went with that. The critical care services 99291, 99292. We went over that. You're just going to read that, and I still want you to look up these same codes. Okay, some of y'all that are new to this class and you guys didn't see this class that we already did, they did this already, but I want you to look up these codes anyway. Okay, everybody look up the codes. You see the minutes? Look up the minutes and look at the codes. Okay, because this is going to be on your exam. No, you're not going to have this book in there. You're going to have your CPT book, but your CPT book is going to have this in the guidelines. It's just going to look different, that's all. But it's going to be the same thing. It's going to look different. Okay? So, just take heed to that, because when you guys are testing, it's a lot different when you testing than when you training. Okay? You're going to get nervous. Okay? You're going to get nervous. All right? So most third-party payers will not pay for more than one physician at a time for critical care services. Highlight that. Okay, so if you have your hard copy, go ahead and highlight that. When you get your book, I want you to highlight that. If you're using the ebook that I gave you, write it down on an index card. Okay, anything you see in this gray area, let me give it to you. Anything you see in these gray areas, I want you to retain. See that? When they show you something like that, make sure you retain that, because that's something that'll be on your test. And your CPC guide, the same thing is in there. It's in a different format, but it's the same thing. So y'all remember what I told y'all. The CPC guide, the CPT book, the step-by-step book, it's all intertwined. Okay. So just make sure you do that. Okay, so we're just kind of creeping down. We already did that. Y'all had a coded shot with that. You guys should have already did that. Those of you who are in the Sapphire Academy, send it to me. Y'all should be sending me your answers. Okay. Y'all should be sending me your answers, because we got to get the rationales from the answer. Those of you who are on YouTube and you guys are doing this, you should have answers in the back of your book. Okay, I don't know if they give you rationale, but let me know if they don't give you rationale. More than likely they do. Whenever they give you any answers or anything to coding, they have to tell you why the answer is what it is. Okay, And the Sapphire Academy, yes, we discussed the answers, we discussed why it's what it is, and we figure out why they got it wrong if they did. All right, so critical care services, we did that. So let me show you what an open and closed question is. I just finally came across one. So you know y'all hear me say do open and closed question first. This is what I mean when I say open and closed questions. You see that question? It's one sentence. You see what they want? One CPT code. That's an open and closed question. Get it, get out of there. Get it, get out of there. You got 2 minutes, 30 seconds, you should be done with that. The rest of that, I want it on the bigger cases. So when you guys hear me say do the open and close first, that's what I mean. Okay. So your first portion, well, there's a first portion, then your second portion is going to be your cases. Your first portion is going to be like open and close question stuff. Okay. Like anesthesia is going to be really quickly, when you get to your cases, when you get to cardiology, and depending on which one you get, you're going to get some real cases, okay? But in this case, that's what I mean when I say open and closed, okay? Do it, grade it. Get the answer and get out of there. So this is what we did this yesterday. So some of you who might have came in my class that are new students, we did nursing facility coding yesterday. Make sure you guys did your homework for last night that you're supposed to do for this, okay? Because it's fairly easy, and you more than likely won't have anything on it. But if you guys want to see if they have nursing home questions in AAPC on that certification, I'm putting it up there right now. And AAPC, you're just going to go to the exam, and they're going to tell you what's on the test, okay? They're going to tell you what's on the test. If anything is in there on nursing home, then you know you've been introduced to nursing home, because in this section right here, I still want you to look at your CPT book, look at your step-by-step book. You don't have to worry about the CPT guide, because that's for Sapphire Academy down the line. You two students, you don't get that, but I still put you in the right place. You still have to get that book, but that's further down. That's further down. When we get to the coding, we finish with the gusto. We finish with the gusto of you learning how to code, of you kind of getting used to what these codes are. You getting used to what ICD-10 is. This is just an introduction that I can do on YouTube. Full blown out classes, I have to do them in the Sapphire Academy. So I know. I saw you typing something. I know, because this is different. That's why they get different stuff than y'all get, but they still in the right place. Okay. I know. I'm going into Sapphire. Whenever I do YouTube, I always go into the Sapphire Academy. So even if y'all get me, when y'all see that green check on there, y'all know I'm in there. And if y'all don't see me in there, I'm on another computer or something. I'm always on the computer. Okay, so let's move on. So like I said, for this we did yesterday. This is nursing facility. I just kind of pulled this up to show y'all. Make sure y'all get this SNF down. Skilled nursing facility. Okay, nursing facility is not a hospital. We went through that already. Okay, professional care staff and provides health care. We went over that. And again, we're just kind of catching up. What's today? Thursday. Y'all's normal class is Friday, Monday, and Saturday. But I'm giving y'all the extra class because I missed a day or two. Okay. Intermediate care facility. Make sure you understand what that is. Provides regular basic health services. Okay. To individuals who do not need the degree of care of treatment provided in a hospital or a skilled nursing facility. A long-term care facility describes health and professional services provided to ill, aged, disabled, or mentally handicapped individuals for an extended period of time. So you see how detailed the step-by-step book is. It's not just, we're going to read the book and be done. No. This book, if you check other medical billing and coding colleges, we all use the same books. Accreditation requires us to use this book. Accreditation requires us to use that medical billing book that y'all see that I use for my class. Accreditation requires us to use the language of medicine book that I use to teach the class. Nothing that I use is something that is not approved by accreditation. You have to use what they tell you to use. So, don't sleep on that, and you have to learn what's in the book. And again, you don't have to sit in a classroom and do this. You can learn this on your own. You don't need to sit in a classroom and pay $27,000 for this. Okay? So yesterday we did do preventative care, but I still wanted you guys to just kind of go over it a little bit because it's such a small section in the preventative care. We did the prolonged services. Look at the coding in the prolonged service. Look at the codes in the prolonged service. These are the codes right here. I know we did it. I'm just kind of backtracking. Here they are right here. I still want you to look at those codes, okay? I told you to write down, get COPD, okay? Put that down. Make sure you got your definition down with that. So this part right here actually goes with that. They're just giving you tests to do. If you hadn't carefully read the notes for prolonged services, they're just giving you more to do. Now, this is something that I want you to look at, and this is going to be part of your study right here. Read this section because that's a part of prolonged services. Okay, that's a part of prolonged services. Remember, we were looking at it yesterday. Prolonged service. I don't know what's going on in my hair. It's driving me nuts. I know. I do it straight, but y'all know I like to have a little bit of wave up in my hair. Okay, so yes, you're going to read this. As the notes indicated, less than 55 minutes of prolonged services are not even reported, but are considered part of the initial service. Because remember, yesterday they said if it was more than 75, then we're going to go ahead and report, right? So you cannot use a prolonged service code until after the first 55 minutes of the prolonged services have been provided. When referencing codes 99215, is important. When referencing codes 99215, all of it's important. CPT instructs to report 99417. Go look at that code. For prolonged services. So you see how as I'm reading, I say go look at that code, because that's how I did. That's how I study. That's how I study. I'm teaching you guys how I study. When I read and I come across any codes, I go look at the code. I stop, I look at the code, or write down the codes that are in the description of the study that I'm reading. But we are doing the class. As I'm doing the class, stop, go look at that code. Okay? You still have ears so you can hear what I'm saying, right, guys? Good. That's a study trick. Okay, so 99417, we know what? Okay, I'll get to you later. Okay, so I'm sorry, y'all. I can't today. So 99417 is prolonged services. All right, where's the book? What's this for? Can y'all see this? I'm gonna put this up here. It's not this book, but I'm looking for the other book, but I already had it up, so I want to show you. That's the step-by-step book, y'all. That's your ICD-10. This is the one I'm looking for. Okay? This is the book that I gave you guys. Okay? This is the 2025 edition. You got about 30% in this book. Okay? You can give this book to anybody you want to. There's a link right here. When you go to open this book, it should give you a link. If you want to purchase the ebook, go ahead and purchase the ebook. But this is free. This is free. It's not necessary for you to have an ebook and a CPT book, but if you could, I would love for you to, but you need hard copy when you do your tests. Okay, but I wanted to just pull this up just for, the sake of people who may not, know that, this book has everything in it that you need, especially at the beginning. Okay, modifiers, symbols. We already did this. You guys already went over this. Bilateral procedure, multiple procedure, 52 reduced services. Okay, we already went over that. This was old classes, but I still wanted to kind of show you guys this, especially some of you who have not had my class before. So let me just get back to your other program, but I want you to show the CPT. So when we're training, even if you have your ebook, and you see a code and I say go look up this code, go ahead and look up the code just so you can visualize the code and what you need to code it. In your CPT book, it's going to show you what description you need in your documentation in order for you to use that code. So if you have something like this is considered documentation. So if you have something in your documentation that allows you to use that code, your CPT is going to tell you whether you can use that code or not. This one, the standby services, the code 993660 for standby services is reported when a physician, at the request of another physician, is standby in case his or her services are needed. This is good in case delivery. A woman is delivering a baby and you have the OB delivery person in there and the medicine doctor standing on the side in case that baby can't breathe. You see what you see? And I'm only saying it like this because I've been physically in on situations like that because I worked in the OR. That's why I can visualize craniotomies and different type of surgeries because I was in the OR. How you going to do it? Pull them up on YouTube. Pull it up on YouTube. I want to see a surgery with a standby provider. I bet you YouTube will pull it up. I'm telling you, YouTube got everything. So don't sleep on YouTube to help you out. Okay, because that's why y'all in my class, right? It's YouTube. All right. So the standby physician. And take it down, put it on your index card. Your standby physician cannot be rendering services to another patient. So he can't handle patient in the hall, he can't handle patient next door that he's looking at. During this time, this is crucial, okay? This is crucial. I'm backtracking because I want y'all to go over this. I got y'all up? Yes, I do. Go over this. Go over this tonight. Okay, go over this tonight. Okay, this is crucial. Okay, an important note concerning the standby code is that this code is reported only when there is a documented request in the patient medical record and no service is performed and there is no direct contact with the patient. This is saying in your CPT book, it is the same thing. It is just inside the guidelines. Let me show you something. If you put go look at 99360. When you go look at 99360, you're going to see the description in there of what you need for that code. This is what they tell you right here. I don't know if you can see the mouse or not, but you see this section right here? They're telling you the same thing. They're just being more detailed, because it's a training book. They're saying it so that you can decipher what they're saying. Y'all got it? Good. Okay, so let's move on. I know prolonged services. Yes, you're going to do those exercises for the prolonged. That was actually last night. This is prolonged services. But y'all know how I have to repeat, what we're doing because people do archive. Care plan oversight services. We did that yesterday. Remember, preventative care. Okay, preventative care services are services that providers do on an everyday basis, more likely at well clinics. We went over it yesterday, and who was that? Tanya asked for us to go. We were going over it today, but they wanted to work for last night, which was fine. Preventative services, look at 99381, 99429. Okay, look at those codes. All those codes in the CPT book from there. So you remember last night, this book has these codes in there. Okay, report the routine evaluation and management of a patient who is healthy and has no complaint. So there's a medicine section, which we haven't done the medicine section yet, okay? It's a medicine section and a primary care section. The medicine section is something is wrong with the patient. The patient needs to be seen by a specialist. Preventative medicine is the provider is taking care of the patient to make sure she doesn't get to the point where she needs to see a medicine doctor. Okay? So remember, a medicine doctor, you can look that up. Medicine doctor is somebody who's dealing with somebody who has an issue, diabetes or something like that. Okay? High blood pressure. Okay? And they have a plan. Okay? I know, I'm not going to go the whole thing. Okay, if the physician should encounter a problem or abnormality, what I was just telling you, I'm going to read this right here. If the physician should encounter a problem or abnormality during the course of a preventative service, and the problem or abnormality requires significant additional services, you can also code an office visit. Now, the office visit will be the medicine visit. Okay, that will be like a medicine visit, because I looked at him for the well visit and I looked at him for his issue. So that's 2, and you're going to add that 25 code on there. Go to modifier 25 and just read real quick what it's about, what it's for. Okay? I know I'm ready to tell you, but I still want you to look at it. The modifier 25 is added to indicate that a significant separate identifiable E&M evaluation management, because this is evaluation and management, services was performed by the physician on the same day as the preventative medicine service. So you got your preventative medicine code, and then you got your office visit code. Right? Because preventative medicine, what was it? 9981, 82, 83, or 998 something, and the other codes were 99212, 99213. Good. I know she got it quicker than me. Okay, so again, yes, that's what I want you to go over, okay? We did non-face-to-face, we did direct face-to-face and non-face-to-face. You guys don't have to do that. We did that already. Digitally stored data, remote psychological monitoring. This is not on there, but you guys can do this if you want to. I'm on page 320. Okay, it has to do with the face-to-face, but it's actually just telling you what types of face-to-face that we're going to do. So yes, you can go ahead and do this. This is going to be part of the homework tonight, all right? Special Evaluation and Management Services, 99450 through 56. Read that. Well, we got 10 minutes. Okay. So exercises from 11 to 17 I want you to do. So now you should be able to do coding by now, all of the classes that we did. Believe it or not, this is actually your 22nd class in coding. This is 22nd class, okay? It's probably your 28th chat. So you guys remember the beginning. The coding class is like 60 classes. It's like 60 classes. And every single one of them will get done. We're not going to be finished with the coding classes. And once I finish with these classes, and let's say somebody new comes in, she can do 3 chats a day. You know what I'm saying? I am going to be that long. If I was in a regular classroom, I would have at least 4 or 5 classes that I'm doing a day. I'm doing those classes 1 hour a day, 2 hours a day. So when you're doing it on your own, you're not looking at one class because there's 60 classes. You're going to be doing 4 or 5 classes a day, which will only make you like 2 weeks to finish this course. You see? So don't get scared. Don't get scared. But I want y'all to do this right here, okay? That's y'all's homework, okay? We only got 9 minutes left for the class, but this is actually almost finished, okay? So, again, what I want y'all to do is just, steadfast, okay? So let's do newborn care services. Y'all still got your book out? Make sure you got your book out. We're going to do newborn care services. And again, we are in, I know, y'all know I don't have my regular chair, but I'm going to have it tomorrow. They're bringing it for me tomorrow. The newborn care services, again, in that CPT section of that book, I want you guys to make sure that you review that. So the book that I just gave y'all, the Kindle, the CPT book. You can go in that book. So you should have my class open, and then you can have the CPT stuff open. So newborn services are where we're at. Okay, so you guys are going to do the newborn services. Again, you're still going to look at those codes. Okay, it is literally telling you, when you go in here, I want you to also read the guidelines. Okay, newborn care services report services to normal newborns. Okay, note that there are 3 history and examination codes. 3 history and examination codes. One is specifically for a newborn assessment and discharge from a hospital or birthing room on the same date. 99463. Open your CPT book and y'all go look at that code. When you look at that code, there's going to be guidelines over there. There's going to be guidelines over. The guidelines are going to keep you in the right place. Okay, I'm right here. 99463. Go look at that code. One is for hospital or birthing room deliveries. You guys should have this book too. So I don't need to really keep this book open all the time. I gave you the link for this book, and this is still the beginning, so you still have this book. Okay, guys? Y'all want me to go see? Let me see. Let me find it. Is it this one? So what page was I on? Like 360? Wow, we ain't all the way down there. Where's your page numbers? Oh, okay. So it's in here somewhere. This one might be different. Yeah, this one's a little bit different than mine, y'all. This one's a little bit different than mine. Let me see. Their pages is different. So, reimbursement and HIPAA. Yeah, the pages are a little bit different, but it's the same thing. So this conflicts. It doesn't conflict, but it's complicit with the CPC guide, the business of medicine, reimbursement, HIPAA, and compliance. That's like the billing stuff. Okay. This is the first chapter in the step by step. I'm just kind of checking it. This one is the one that I gave you, privacy. Yep. So same thing. So I probably need to go like right here. Let me see how far this one went. ICD-10. So this one has the ICD-10 code and shot third-party payers. All right. So from what I can see, 25-year-old female present initial presentation. This is for so look, see where the Z codes are right there. So this is just telling me that we still in ICD-10. So this book doesn't look like it go as far as I wanted it to go. ICD-10. All right. So okay. So this one actually go back. This one is still good. But this one doesn't go as far as I wanted it. It doesn't go as far as I wanted it to go. So in the Kindle book, you may not be able to get to go as far as I wanted you to go. But go to thrift.com. You can get this book for probably $10. Okay. No, it doesn't have to be a new book. When I just get whatever you get 23 to 24 to 25. Okay. I've seen somebody got one for $5 on thrift before. I know, because everybody wouldn't know, but they don't even know you got the same stuff in it. If a code is changed, now that's why I want to make sure you get the new CPT book, okay, in case the code is changed. But if a code is changed, I'm going to tell you to flip that code. So if you got a 2023 book, and let's say I'm on page 321, and you got 2023, and 99466 is something else to be something else. The evaluation and management codes are not changing. The most thing they're going to say is, oh, we don't use that code no more. They're not going to change 99215 to, something else. Okay. So, again, newborn services, I want y'all to go ahead and look at that. You're going to have to get this book because the temporary one, the book that I gave you doesn't go that far. It only gives you like about 30%, but it gives you the whole training that I already gave y'all for the ICD-10. Okay, so for the newborn care services, I'm gonna hit this one up here again because I need y'all to go find these 3 codes: 99463, 99461, and 99462. Newborn care services, okay? Newborn care service codes 99460 through 65. Report services to normal newborns. It doesn't say nothing's wrong with the baby. The baby was delivered. Nothing is wrong with the baby. Note that there are 3 history and examination codes. One is specifically for a newborn. Now, the newborn codes do not bump into the mother's codes. They're totally different. Once that baby is born, his codes go on his claims. Okay? I know, I'm telling you right now. What if you work only for OBGYN? You see, if you're only going to work for OBGYN, I don't see the reason for you to take the full CPC. Just take the certification for CODA for OBGYN. Of course you can. You don't have to take the full 21-point CPC. No, you can if this class and any other school teaches you all sections of the body, all chapters in the CPT book, because you never know where you're going to work at, where you're going to be pulled at. But once you finish with this class and you say, I want to focus on OBGYN, don't register for the CPC. For what? I mean, I would recommend to do the CPC, but so you can study. And what if you want to code somewhere else, or you want to code another specialty? But if you know, no, I'm not going to work nowhere else, I'm only going to work for OBGYN, I'm telling you right now, okay, then that's what you're going to study. After you learn the coding, after you learn the trade, finish these classes, then you're going to focus only on OBGYN. Only on OBGYN. You're going to already have this information. You're going to already have the business of medicine, the HIPAA that came with the first of the step-by-step. Don't kill yourself doing the CPC if that's not your field. It's not, if you're not going to go into all subjects. The CPC has all 21 points. 21 points is, look at your CPT book, you know what I'm talking about. The surgery sections, evaluation, cardiology, ophthalmology, all of them are there. ENT, all of them are there. So you see that we're going over all of that. We haven't even hit the gusto yet. We are at the point where you guys are learning how to code. Evaluation management is just your first stop. And you're in that evaluation and management section. Once you finish with evaluation and management, let me show you. Look, you see over here, this is where we're going to be at. Evaluation and management is just long because it covers all different points. It covers all different medicine services, well, office services. So here, look, anesthesia, surgery guidelines, integumentary, musculoskeletal system, respiratory, cardiology, hemic, lymphatic, mediastinum, and diaphragm, digestive system, urinary and male genital, reproductive, intersex, surgery, female genital system, maternity care and delivery. Okay, if that's all you're gonna do, this is what you're gonna focus on right here. When we get to that class, this is what we're gonna be focusing on right here. Right here. You see what I'm saying? So if you got a specific doctor and that's all you're gonna do, that's what I would do. See, doing cardiology and orthopedic, and I had somebody call me, Lisa, can you help me with so-and-so? I'm changing over from IDX to Athena. She was OBGYN. I had to be OBGYN savvy in order to take over her office. If he calls me in orthopedics, I need to go over there. So that's why I have all of it. You don't need all of it if you know you're not working in no other specialty. Okay. Oh yeah, of course it's going to limit you because that's the only thing you're going to be able to be certified in. If you get your CPC, you'll be certified in it all. Okay. Will the OBGYN test be easy? Of course it will, because that's all you're going to do. They're going to give you all these different cases. They're going to give you cases that relate to pregnancy, birth, women. Absolutely, absolutely. So, you don't have to do, all points. Go to AAPC and it's going to show you all types of tests that they have in there. So I prepare you. I'm sorry, I got stuff everywhere. I got them all on mute, so everybody should be texting me, y'all. But I'm still catching y'all, so don't think I'm not catching the questions. I'm gonna hit y'all up, and y'all know every time I do a chat, somebody asks me a question, I always talk about it in the chat. We talk about it in the chat. So if Trina asks me a question, Keisha and them, I always talk about it in the chat. But anyway, if you're gonna only do OBGYN, I would stat first in OBGYN, you know, but just get the classes in, okay? Um, don't be afraid, like those big cases that y'all see there. Don't be afraid of those big cases. Trust me, by the time you finish with the class, that's why I hope y'all join the Sapphire Academy, um, because the resources and the work that we do in there, when you're working online, now online schools are mostly the same. My school was built on the same coordination as any other school, online school. The difference with it is I give you guys a one-on-one, and if you need me and you're not understand, you literally get me live more than just on here. You still archive my chats just like everything else. You still archive the chats. Okay, I know I'm over. I'm supposed to be finished by 8 o'clock, but try and join the Sapphire Academy because I will have to put these on private. I will have to put them on private. We're still in codes. I'm not going to knock them out. Once the class is over, it goes private. Okay, so let me get back to the book because I know I'm keeping you guys a little longer. So do the newborn services, delivery and birthing room attendants, resuscitation services, delivery, birthing room attendant. Look at these codes. I know I kept y'all a little over, but we almost finished. So you see, if you decide that you are going into, labor and delivery, OBGYN or GYN office work, uh, trust me, that she needs you to be her right hand. Okay, you better make sure you know when to do an add-on code. You better make sure you know when to drop her claims. You better make sure that hospital gives you the notes right after that baby is born. You got 48 hours to get those notes. They should have those notes prepared for you after that baby is born. Okay, so absolutely, you're gonna have to call for them notes. When you work for OBGYN doctor, you have to work hand in hand because remember, you doing the coding for her. She just going to the hospital to deliver the baby. I'm sorry, going to the hospital to deliver the baby. Okay, delivery birthing room attendants 99464 99465. Code report the attendance of a physician at the request of the delivery physician. Remember, they do his charges, you do hers. Okay? To provide the initial stabilization of a newborn for the resuscitation. Remember, they were talking over two surgeons in there? See, this is a whole different surgeon. This is the surgeon that doesn't deliver the baby. This is a different one. This is a different provider. See? So go ahead and read that. I know I was trying to finish y'all by 8 o'clock, but I look like we're going to have to do another class on A&M, okay? Because I don't want y'all to rush through this. Okay, I don't want y'all to rush through. Don't get all the way down. We're talking about congratulations. Because look at these codes y'all got to do. A physician is called to the intensive care unit at the local hospital to care for Joe West, a patient in coronary crisis. The physician spends an hour at the patient's bedside, stabilizing him. Now, what do we have to remember on this? We got to remember, one, we are in E&M. Evaluation and management. So your mind is not going towards the surgery codes, right? Where's that case at? Can y'all see the case I'm looking at? I'm on page 328, okay? Make your screen bigger if you don't have a book. All right? I'm only supposed to have this up for 30 seconds, but this is educational. YouTube, don't snatch us down. I'm just trying to get y'all to decipher how y'all going to code this. Okay, okay. They're only asking for CPT codes. Okay, if it was asking for an ICD-10, then you would see a line for ICD-10. Okay, so and then they're only asking for one code. So it says a physician is called to the intensive care unit at the local hospital to care for Joe West, a patient in coronary crisis. The physician spends an hour at the patient's bedside stabilizing him. What is the CPT code? Tell me what a CPT code is. Current procedural terminology. That's what you are looking for in here. The current procedural terminology. Okay? A physician is called to the intensive care unit at the local hospital to care for Joe West. A patient in coronary crisis. They're describing what's wrong with the patient. They didn't ask you for the diagnosis code, so you're not going to aggravate with the coronary crisis. The physician spends an hour. Pay attention to the time. Why, Miss Lambert? What is that? Because they're throwing me up. Pay attention to the hour. Why? Because time, E&M is called by time. At the patient's bedside. Bedside is telling you what? He in-house. Exactly. Stabilizing him. So, in all of the coding, CPT, what is the provider doing? What is the provider doing? Even though we just went over all of that, I just kind of picked that one out of random. Okay. I just picked that one out of random. Right here is where I want you to start. Okay, that homework. I'm just kind of scrolling up. We already did the newborn. Okay, I just kind of used that one. I don't know where I got that one from, but I used that one as an example. Cognitive assessment and care plan. I'm not going to go over this because we already gone. I'm not, and I hate to rush through. But I gave y'all that just a random little open and close case. It's open and closed because it wasn't nothing but this big. So let me see. He said 50 minutes, right? 50 minutes. 99214 first edition of 30. I ain't giving it away. I ain't giving it away. Just for tomorrow. Just for tomorrow. Okay, just for tomorrow. This is for tomorrow, okay? Because it's not that much. Look. That's it. It's going to say, congratulations. Once we get all the way down here, we done. Okay? That's what y'all going to do. But tomorrow, we're going to actually code. We coding tomorrow. All right? We coding tomorrow. I mean, y'all should be coding now, but we're going to stop right there. Let me show y'all where we're going to stop at. I don't know where we was at. What I just gave y'all is on a random. We're going to stop right there. Let me see. And I'm going to show you how to documentation. We ain't get right there yet. Okay. Up. Psychiatric collaboration. Care management. Did we do care management the other day? Cognitive assessment. Newborn. We just finished doing the newborn. Hold on. So the newborn service. So this is y'all's homework for tonight. The newborn care services. Delivery, birth and room, and resuscitation. Okay. Pediatric critical care. Okay, that's what y'all reading tonight. Okay. Inpatient, neonatal, and pediatric care. Now, you see where it says neonate 28 days or younger? Put that on the index card. Pediatric, 29 days through 24 months of age, 2 years old, 5 years old. Put that on the index card. Okay. I want to go back over that. Okay, I need to go over that more in depth. I'm gonna go over that a little bit more in depth with y'all. Sapphire Academy, y'all already have this. We can go over it more in class. So Sapphire Academy, this right here, y'all already passed this, but I'm gonna go more in depth with this. YouTube, we're gonna go over that again tomorrow because I want to go back over that. YouTube, make sure you got your CPT book to go over these. All right, initial neonatal intensive care and pediatric. So this is where you're at, YouTube. Newborn care services, delivery, inpatient neonatal. Stop. Okay? Inpatient neonatal and pediatric critical care, we're going to do that tomorrow. All right? Because y'all got a class tomorrow, and I can't rush through that. I gotta make sure you guys understand how to get those codes. So I'm hoping y'all got your CPT books. Okay, and your CPT books should go up to that. So tomorrow we're going to actually do the coding. I want you guys to understand how you pinpoint the codes. I know you guys been doing practice XYZ. Tomorrow we going in. I'm going to show you how you decipher what is the procedural code. See how I read that little case that we did today? Because a lot of it at the beginning, okay, so if your question is not asking you what the diagnosis is, don't worry about what's wrong with the patient. Don't worry about what's wrong with with the patient. The CPT is your current procedural terminology code. As you're reading the case, you're putting yourself in a state of mind. What is the provider doing to this patient? That's what you're doing. And it's not going to take you 5 minutes to find it in your CPT book, because remember I said you're turning through those pages. You're getting to know your CPT book the same way you're getting to learn how to drive. That's how you're getting to know your CPT book. It is like your Bible. It is like your go-to. It is like, let me retain what's in this book. When you look at the neonatal, section, and you're looking at the codes that are in this section, that's why you have to go through your book. You're looking at those codes in this section. You're already retaining where you're going to find what you need. The easy thing about it is, go look at that chat that I got in there with labeling your book. In your CPT book, you're going to have labels right here. Neonatal codes. Boom. That's what's going to get you there quick. Okay? So that one we just did. Tomorrow we're going to go through it more in depth. So tomorrow the class is going to be a little bit longer. I know y'all just came from work. And I try not to keep you there too long. But tomorrow, you guys look out for the class. So the class tomorrow is still going to be, again, 7 o'clock. Okay? So just look out for that class. It's going to be a little longer. I think I'm going to go till 9 o'clock tomorrow, because I'm still a little leery on some of y'all with the coding. But again, YouTube, the only way you can give me your codes is to Sapphire Academy. Because if you want rationale, I'll give you the rationale for it, to tell you why it's wrong and what you need to do with it. Again, you have to join the Sapphire Academy. Go to my website and you guys can see how to join the Sapphire Academy. Okay, so I know I kept you 15 minutes, but tomorrow, get ready, y'all. We're coding for real. Okay, I know y'all doing homework and y'all trying to do the coding. Y'all haven't submitted anything to me, so I'm thinking YouTube, you all right. That different from Sapphire Academy. I got all of y'all stuff in the file. But YouTube, keep going. Don't give up. We're going to get you there. Okay, we're going to get you there. Okay, look in there. Some of y'all who want to do your own business, look in there. I put how to do your own coding business in there. How to recruit your own providers in there. Once you get yourself savvy enough, go get your own providers. Go get your own doctors. Code and bill on your own. Get your LLC and run your business. You guys see, when I be out of town, when I'm out of town, I'm going to different states. I recruit the hospitals and doctors in different states. What I do is I train them to get their certification. I train the billers on the billing. I train them on federal government issues. The same thing I'm showing you guys is the same thing that I do when y'all see me, I'm out of town. Okay, so thank you all for watching. I appreciate y'all. I'm going to see y'all tomorrow, 7 o'clock. I have not made that thumbnail yet, but I'm going to make it in a few minutes. Okay, so thank you for watching. Do not forget, make sure y'all have your books. Go to thrift.com. You might can get them for $5 or $10.